How FDA-approved PEMF technology can help you heal your COVID-19 patients faster. Pulsed electromagnetic frequency therapy was developed for NASA to treat severe bone loss in astronauts when they returned from space travel. It's an FDA-approved medical device that has been used in modern medicine by orthopedic and neurosurgeons for 3 decades to help regrow bone, and the technology has been covered by insurance companies for non-unions and failed fusions for 30 years. In the past 10 years, it was noticed that patients using the device were having various other ailments heal faster, and it was discovered that PEMF technology can assist in healing not only bones, but nearly every other ailment in the body as well. This is due to its mechanism of action, or how it works. PEMF technology works in 2 ways. It oxygenates red blood cells and pulls these oxygenated blood cells to the area that need them for increased function and healing. Secondly, it also recharges cells that have depleted charge, helping them produce ATP, which gives the cells life force, improving their capabilities and efficiencies. For an organ or any part of the body to work properly, it must be healthy. For it to be healthy, it is continuously moving waste out of the area and bringing oxygen and nutrients into the area so it can thrive. Healthy red blood cells transport oxygen and nutrients to organs to help them recharge and thrive. When organs do not receive sufficient oxygen and nutrients from blood cells, they die, and one has organ failure. PEMF technology oxygenates and recharges cells so the body can work more efficiently. Here's how it works. Red blood cells stack on top of each other like poker chips when our body is exposed to stressors such as environmental poisons like smoke, vapors, gases, radiation, trauma, medications and drugs, lack of proper sleep, life stressors that cause anxiety and fear, and poor diet. Oxygen and nutrients cannot get into the red blood cells that are stacked on top of each other because of reduced surface area of these stacked cells. The supply of oxygen and nutrients and the disposal of metabolic waste in the organs depend strongly on how blood, especially red blood cells, flow through the microvascular network. Because capillaries in the microvascular system are so small, only one red blood cell at a time can pass through them to transport oxygen and nutrients to the organs. These stacked blood cells cannot even get through the openings of the capillary doors to get to the organs. And even if a stack is to find its way into the capillary, the cells of the stack are not oxygenated properly due to the reduced surface area. In the capillaries, normal blood flow would consist of one red blood cell at a time. When small clumps of red blood cells pass through the capillaries, it can lead to endothelial damage. When large clumps of red blood cells pass through, it can lead to major damage or microcapillary blockage. In this case, oxygen and nutrients are not getting into the organs at all. You can pump all the oxygen into a patient that you want, but if the oxygen is not getting into the cells efficiently and not transporting the oxygenated cells to the part of the body that needs it, organs stop functioning and the patient can die. People die of COVID-19 due to organ failure. Organs fail because of lack of oxygen, inflammation, and septic shock. Their organs do not get the oxygen they need for survival. The waste in them then cause inflammation and sepsis, which is extreme toxicity. Pulsed electromagnetic frequency therapy turns these red blood cells into these red blood cells. PEMF technology recharges cells. We know from Nobel Prize winner Otto Warburg that cells have an electrical charge to them. As the charge diminishes, the cells cannot support the organs any longer, leading to loss of function. PEMF recharges the cells in the organs so they can now absorb oxygen and nutrients and expel waste efficiently. Why Curatronic PEMF? There are 2 numbers that you need to know when purchasing a PEMF device. It is essential that you understand these numbers when choosing your device. 1 is the therapeutic frequency, which is measured in hertz, and the second is the power of penetration, which is measured in microtesla. The therapeutic frequency range is measured in hertz, and this is the frequency range that the device operates at. The Earth's natural vibrational frequency is between 0 and 50 hertz, and it's also the frequency that has been determined to be the best and safest frequency for human beings in healing. There are good EMFs and there are bad EMFs. We know that cell phones and cell towers, for example, put off extremely high levels of EMFs that are harmful to the human cells and the body. But we know that 0 to 50 hertz is natural and is considered the safe zone. This is why having a PEMF device that delivers a therapeutic frequency that is in the safe and healing zone is crucial. We don't want to cause additional damage by being out of this zone. We are trying to heal, not cause additional harm. The power of penetration is measured in microtesla. This is the power that the device has to push the therapeutic frequency into the body. You may find a device that covers the right frequencies for therapeutic healing, but they do not have the power of penetration. This means they cannot get that healing frequency into the body. To penetrate bone, for example, to oxygenate and recharge the cells in the brain in dementia and depression patients, you must have the power of penetration to get through the skull bone to get the brain cells deep within. Many devices only penetrate a couple centimeters deep into the skin. This will oxygenate the blood, but it's not going to penetrate the lungs, liver, kidneys, or other core organs to recharge the cells of those organs. Curatronic PEMF has both the safe healing frequency programs and the power of penetration into the body to treat deep into core organs. Curatronic has programs for the lungs, kidneys, liver, and full body oxygenation that have all been studied by major medical facilities and will all greatly help your COVID-19 patients by helping get the oxygen you are administering actually into the cells and transported into their organs for their survival. You can treat patients that first come into the ER, reducing their chances of needing to go on ventilation, and you can also use it on patients already on ventilation in the ICU. There's a foldable travel mat that is ultra thin and can be unfolded right on top of an ICU patient on ventilation without having to lift the patient up and put the mat underneath them. Thank you so much for your time today, and we really are here to support you and help you save your patients' lives. If I can answer any more questions for you or be of any additional assistance, please call me at 424-335-9335. That's 424-335-9335. Thank you.